Dr. Taulant Muka is a medical doctor and epidemiologist working as a researcher group leader of the cardiometabolic health group at the Institute of Social and Preventive Medicine, University of Bern. He has a broad interest in cardiometabolic health, with a particular interest in the role of sex difference in improving prevention and precise care in cardiometabolic disease, such as diabetes and cardiovascular disease. In his talk, he will discuss alcohol consumption and the risk of cardiovascular disease, mortality, and the later onset of menopause in women. Please give a warm applause for the last speaker of this symposium.
Well, hi everyone. Thanks a lot for inviting me to the symposium. It has been also very beneficial so far for me to understand the current evidence on alcohol and cardiovascular disease, but also cancer. However, for this topic, I'm going to focus on women. Actually, the debate about drinking alcohol or not has started, I think, 4 decades ago, and the first well-defined epidemiological study was done in California, where they recruited 400, or in the database health records of that time, they identified 460 patients and compared them to control from the same source population, and they found that drinking alcohol was associated with lower risk of myocardial infarction. And we are still here for 40 years after, and we are still having the same discussions, although now we have more information on alcohol and cardiovascular disease. And also, I will start the presentation with the same data that were already discussed here. We see, of course, a G-shape association with alcohol and cardiovascular disease. And also, it was presented up to 100 grams could be not harmful when it comes to cardiovascular disease, but also all-cause mortality. However, something that we are missing here, and especially if you see the graph comparing with non-drinkers, is sex-stratified data. So there is most of the studies in general, they present the data combining male and women together. And usually also when it comes to women, there is something very important to highlight, and that is menopause that also was presented, but also I'm going to give some more other points why we should focus more on this topic. So when it comes to the metabolism of alcohol, it is very well known now that actually there are sex differences in the metabolism of alcohol, and for the same amount of alcohol that a woman and a man takes, in women we see more effects. And why is that? Well, still it's not clear, but it could be because differences in body composition. Men and women are different also in terms of body fat, body water, and lean mass. And that also can have an impact on how alcohol is metabolized in the human body. And therefore, women having a different ratio of water body fat compared to men could also have an impact on alcohol effects. Another factor that could contribute to these sex differences is also related to the enzyme that breaks down the alcohol in the stomach. And humans usually have generally lower levels of the alcohol dehydrogenase enzyme, and therefore can make them more susceptible to the effects of alcohol. But also another reason that you usually find in the literature is also the metabolism of alcohol in the liver. Usually women have more liver mass, which could also impact could lead to a faster metabolism of alcohol. And also something not to neglect is also the role of alcohol on altering sex hormone levels. Alcohol actually is considered to have pro-estrogenic effects. So there are several studies to show that alcohol indeed can alter sex hormone levels, and especially estrogen, but not only estrogen, also DHA sulfate, which is the precursor of both androgens and estrogens. And definitely, sex hormone levels shape also the different phenotypes that we see in men and women, and also those related to cardiometabolic health, including here cardiovascular disease and type 2 diabetes. So these are some of papers that we, or together with my group, we have published on sex hormones and cardiovascular disease and type 2 diabetes. And one of the studies we showed that actually DHA, which is the precursor of both androgens and also estrogens, is associated with increased risk of type 2 diabetes. And there could be a slight difference between men and women. Here, there is another study. We compared the levels of different sex hormones, including estradiol, testosterone, sex hormone binding globulin, and also free androgen index, which is a marker of free testosterone. And we compared across the tertiles of having a cardiovascular risk according to American Heart Association. And we actually see major differences between men and women. And also, these are data from original data analysis, but also meta-analysis showing that estrogen actually, especially in postmenopausal women, could be associated with increased risk of type 2 diabetes. And testosterone probably doesn't have any effect or could have a slightly increased effect, and we see sex hormone binding globulin to be associated in women with lower risk of developing type 2 diabetes. So definitely there are reasons behind why we should look at alcohol effects by sex, and also why we should look at alcohol and cardiovascular disease. Sex hormones could be one pathway, but also could be the effects on lipids. And we know, for instance, that alcohol is associated with changes in HDL cholesterol. Also, although yet the evidence is not that convenient, that's consistent. And also coming to menopause, that also was presented earlier. Well, there are several issues women actually experience during menopause. There are the menopausal symptoms, which include hot flashes, night sweats. And actually, we have done several meta-analyses on this topic, and we show that women who actually experience menopausal symptoms like hot flashes and night sweats could be at increased risk of developing cardiovascular disease and all-cause and early death. Of course, is the drop of estrogen, which we see, and that's a drastic drop on estrogen levels in women. And on the other hand, we see an increased levels of iron because women are not menstruating anymore, so they are not removing the blood, and therefore you have more iron levels. And there are many studies to show that actually high iron levels in the blood could be associated with adverse metabolic health effects, including here type 2 diabetes. Well, it was also introduced earlier, body composition. So we see more women having a fat in the abdomen. And also, there is also changes when it comes to bone components of the body. And also something that I will come later is also the time when menopause starts. And there is now lots of evidence to link early onset of menopause with increased risk of cardiovascular disease, type 2 diabetes, and other health conditions. But we still have to keep in mind that later onset of menopause is associated with increased risk of cancers, especially breast cancers in women. And maybe that's due to due to exposure to higher estrogen levels over time. So, after summarizing all this evidence why we should look at alcohol and cardiovascular disease, and with a focus on menopause, which could also modify such effects, we performed a systematic review and meta-analysis. Actually, we didn't focus only on alcohol. We focused on lifestyle factors, including smoking, physical activity, and so on. However, for this symposium, I'm going to present only the data on alcohol. So what we did is that we searched in 6 databases, relevant studies that looked at lifestyle factors, including alcohol and cardiovascular disease, also all-cause mortality. We included only cohort studies, so prospective population-based studies. The studies that evaluated one of the following lifestyle, including alcohol intake, and actually we involved only perimenopausal or menopausal women. So only the studies that showed data that showed the association of alcohol with cardiovascular disease and all-cause mortality in menopausal women. And also we took the age of 40 as a proxy to define women being in perimenopausal or menopausal period. However, that's not the best proxy you could take because some women start the menopause later. However, we performed a sensitivity analysis, which I will show later, and the idea is that it's challenging to get such data, and especially, so most of the studies do not stratify by sex, and most of the studies, of course, do not stratify by menopausal status in women. So overall, we found 17 articles that looked at alcohol, cardiovascular disease, and all-cause mortality in middle-aged and elderly women. And those included 880,000 women overall. There were, not all of the studies could be meta-analyzed because some studies focus on cardiovascular disease, some studies on cardiovascular disease mortality, some other studies on all-cause mortality, and some studies looked at different thresholds of alcohol, so it was not possible to pull all data together. However, these are the results of the study. So we have, we could actually get the data to meta-analyze the data for moderate alcohol intake and looking at coronary heart disease, cardiovascular disease mortality, and all-cause mortality, and the same for high intake. As you can see, for coronary heart disease, we found on 5 studies, including 2,540 events, and we saw that moderate intake of alcohol was associated with almost 30% lower risk of coronary heart disease. The same similar results we found for cardiovascular disease mortality, although 3 studies, and also for all-cause mortality, there was a lower risk of developing early death. Women consuming moderate alcohol, having moderate consumption of alcohol compared to non-drinkers. So I need to make clear that the reference group here is non-drinkers. For high intakes, we had only 2 studies, and of course they showed increased risk of cardiovascular disease, and we found only 1 study that looked at all-cause mortality reporting no effects. And to also clarify, moderate alcohol intake was defined as 98 grams per week or lower, which corresponds to 1 dose of alcohol per day, or 8 to 14 grams of pure alcohol. So that was the definition of moderate alcohol drinking we used to meta-analyze the data from different studies. But as I mentioned earlier, of course, there could be lots of confounding here, especially with because we were interested on the effect of alcohol in postmenopausal women, and having the age of 40, definitely it's probably not the best, the base proxy to take. So we looked at the data only in women 50 plus. And because the mean age of menopause is 50-51, it differs by country. So we just limited the data among women with 50 plus, and we saw similar results. That's moderate alcohol consumption compared to non-drinkers in postmenopausal women was associated with lower risk of developing coronary heart disease and also all-cause mortality. Whereas high alcohol intake was associated with increased risk of cardiovascular disease mortality. Well, as I mentioned earlier, because my other interest was also to look at alcohol and menopause onset. Actually, the age at which menopause starts can differ by country, and here are some global data, which includes, well, mainly data from United States and Europe. And as you can see, almost 15% of women experience early or premature menopause. So premature menopause is considered lower than 40. So when you experience menopause earlier than 40 years old, and when you experience 40 to 44, then it's early menopause. And we see the same, almost the similar distribution in the Netherlands. And here is the Rotterdam study, which is a population-based prospective study in Rotterdam. And we see similar distribution, similar trends also when we compare to global data. And why is that important? It is important because lots of evidence now is linking the age at which women enter menopause with health in general, including here cardiovascular disease, type 2 diabetes, and all-cause mortality. And through the data from Rotterdam study, but also through systematic reviews and meta-analysis we have published, we have shown that early age of menopause, so start of menopause before age of 45, is associated with almost 2 times higher risk of developing type 2 diabetes, 50% increased risk of cardiovascular coronary heart disease, and 20% increased risk of mortality. And from the data from when it comes to diabetes, which we used Rotterdam study, we adjusted for many cardiovascular risk factors, including here hypertension, lipid levels, also sex hormones, and it didn't seem to change the effect, which probably means that there is some other mechanisms that are playing a role on how early onset of menopause, if that is causal, leads to later menopause onset, to to cardiovascular disease, and also all cause to type 2 diabetes and also cardiovascular disease. So, therefore, considering that age of menopause could be a marker of aging and also cardiovascular aging in general, we were interested to look at the effect of alcohol consumption on age of menopause. And there are some mechanisms behind why could be an association. There is evidence that shows that alcohol intake correlates with higher levels of FSH, and in women of childbearing age, and also with oxidative stress in rats. And also there is data to show that alcohol consumption does not alter menstrual cycles, and therefore could also impact in general women's health and maybe also menopausal transition. So actually we did a systematic review and meta-analysis on this topic, which is also published in Human Reproduction Update. And again, we searched 6 databases, included both observational, cross-sectional, and prospective studies that had reported, that had looked at the association of alcohol behavior with age of menopause, and were conducted in women. And also we excluded cohort studies that were focused on cancer patients, because there could be a very heterogeneous population, and maybe we could not see, it's not the right population to investigate such effects. So overall, we found 22 articles. After screening, we found 22 articles based on 20 unique studies, and 12 were cross-sectional studies, and 8 were population cohort studies. So here are the results of the cross-sectional meta-analysis. So as you can see, here you have also the fixed and random effects. Well, I think the most right way is to represent the random effect analysis, but most of the journals nowadays also require to add the data on fixed effects. And you can see that women who drink alcohol compared to women who do not drink alcohol, and here we didn't look whether it was low or moderate alcohol drinking because we couldn't get the data from the studies, were associated with lower risk of developing earlier menopause. And actually we saw kind of similar results, although albeit a bit weaker, also in prospective study. So also using the data from large prospective studies, we saw that women consuming alcohol compared to women who did not consume alcohol were linked to later menopause onset. Actually, there were some data we could extract from the papers to look at the dosages, and here you have the results. For women drinking 0 to 8 grams per day, higher than 8 grams per day, and higher than 16 grams per day. And all of these groups compared to women who do not drink alcohol were associated with later onset of menopause. That's why we concluded that probably is low to moderate alcohol drinking, because the last group we couldn't stratify further. That probably is linked to late menopause onset. So saying all this, that low and moderate alcohol drinking could lead to, could be associated with better cardiovascular health, but also to later menopause onset, we have to keep in mind that probably alcohol could be just a marker of overall lifestyle. And actually in the paper that we looked at the first meta-analysis, there were several papers that looked at combination of lifestyle factors and cardiovascular disease and all-cause mortality. And they showed beneficial, of course, beneficial effects. And maybe the ones, women who drink low to moderate alcohol levels, probably they in general engage into better lifestyle, including here more physical activity and less smoking and so on. So, and from these studies, it was very hard to distinguish such, to distinguish the effect of alcohol, because also not all studies adjusted for all potential confounders. And also some of the studies were at high risk of bias as it was evaluated by, when we evaluated the quality of the studies. And then the question is, what we see is the effect of wine or the effect of beer? I mean, there is lots of evidence that show in general that women consume more wine, and therefore what the effects we see could be more of wine. And also wine has polyphenols, have phytoestrogens, which also could lead to or could favor cardiometabolic health when they are consumed in low and moderate levels. But well, we also heard that beer can also contain phytoestrogens, and it'd be interesting to look at phytoestrogens from different sources, whether actually it has an impact on the outcomes presented, I just presented. So, but so far we didn't identify any study to look at different types of alcohol and how that affects cardiovascular disease and also menopause onset. Something also to keep in mind that it was also mentioned here, binge drinking is also a big issue, and especially in many countries. We see here the data from United States, almost 14 million women are doing binge drinking, and therefore we know that that could have a worse effect compared to regular drinking or low and moderate alcohol when it's spread out through the week. And also, when we see the effects of alcohols, we don't have to focus only on one outcome, that is cardiovascular disease or age of menopause in my case, but we have to focus on seeing the overall picture. And we know that low and moderate alcohol intake is associated in general with better health, being that cardiovascular or non-cardiovascular. However, as it was shown, it could lead moderate or higher dose, higher alcohol intake is very harmful, and that is something we should also keep in mind. And it's harmful for many outcomes, including here cancer as well. So to come to the conclusions, we found low moderate alcohol consumption might be associated with later menopause onset, and also can lower the risk of cardiovascular disease. However, we don't know whether this effect is causal or it's other confounders we didn't take into account are playing a role. More actions are probably needed also to communicate to the public that low to moderate alcohol consumption may have overall health benefits. And also we need more large prospective studies or clinical trials to see how different types of alcohol, different dosages could affect cardiovascular disease and health in general, and especially menopausal women. So, thanks.
Any questions from the floor?
Thank you for this interesting presentation. Do I understand you correctly that the postponement of the age of menarche is also causing the reduction of cardiovascular disease in postmenopausal women, or are these just two separate things?
Age of menopause.
Yeah.
Well, that's a good question. Actually, we did a Mendelian randomization approach, combining 3 cohort studies from Netherlands and also United States, and actually we found a causal effect of, so early menopause onset could actually lead to higher cardiovascular events, and that being causal. But that's still an area under investigation, because there are also other studies that show that maybe higher cardiovascular risk could also lead to early menopause onset. So it could also be bidirectional, and that's something we don't know yet.
Yeah, that would be another question. I mean, what factors are known? I'm not an expert in menopause. So what factors are known in menopause determining the age of onset, and how does alcohol fit in there? Is it an important factor or not?
Well, actually, this is a new area, so
Yeah,
there are
new
not
area,
many
but
studies.
if you look at the effects,
But I think there is some genetic component of the menopause onset that, if I'm not wrong, it's around 20 to 30%. But lifestyle definitely plays a role. But there are not many studies actually looking at how lifestyle factors impact menopause onset.
Okay.
And the ones that are available are are usually cross-sectional studies or not with enough power or follow-up.
Do you expect that non-alcoholic beer would have similar effects as the alcoholic ones?
That's also what I doubt. Also what I wonder. The idea is that it depends a lot also on the content of the non-alcoholic beer. If in the content of the non-alcoholic beer we have compounds that biologically could be linked to early or late menopause onset, definitely could have an impact. So we don't know why we see these relations. So I cannot really have an idea of what we could see in the future, but it would be interesting. And also from the data presented on osteoporosis and in the cohort.
I don't want to be blasphemic, but if we have seen today all these J curves and then also this thing, maybe it's if we just have a liver to reduce the effects of poisons like alcohol, maybe it is that most of the alcoholic drinks have positive and negative components, and as long as you don't do it too much, the positive may be stronger than the negative. So that's why we go into this reduction of risk, and then the alcohol is just above the level, and then you get the risk. So maybe the alcohol is the wrong focus. Maybe
it could be, but that's something I could not answer based on the data we have. And I think that's why also I asked the previous speaker that probably comparing beverages containing alcohol, so beer with alcohol and without, probably could give an idea whether there are the components of the in the beer driving the effects we see, or whether it's alcohol per se, or it's a combination of the two. And maybe like having a balance between the two in the beers or wines we consume could be the best approach in the future. And that's why we need to understand more why we observe such effects and what drives such effects.
No, I like it a lot, your presentation. However, related to this question about what happens with beer without ethanol, but in the food frequency questionnaires, could you could get this data really? Because I wonder if there is this question present in the food frequency questionnaire to differentiate between beer with ethanol and without ethanol.
That's something probably that could be done in the future. Actually, we meta-analyzed data from published studies, and in the published studies you could not find such data. So that's why we were limited on looking further and looking at different types of alcohol and so on. But right now one of my students is working on that topic and looking at lifestyle factors in general, how that affects age of menopause, using some Kohlhaas cohort in Switzerland. So probably based on those data, we might take some more information, whether different types of alcohol or also ethanol could impact menopause onset.